Hello, you're watching News 9 Facebook Live with me, Amrita, and I will be discussing with you the effects of mental health on coronavirus patients and what is the correlation between the two. So, in a latest study done by Italian researchers, it's a very small study which has been done. It was found that 55% of 402 COVID-19 patients who were observed seem to display some or the other sort of psychiatric disorders. So the study titled Anxiety and Depression in COVID-19 Survivors says that 28% of the COVID-19 survivors surveyed had post-traumatic stress disorder. 31% of them had depression and 42% had anxiety. 40% of the patients showed insomnia and 20% showed symptoms of obsessive compulsive disorder. So given all of these aspects, it is given that mental illness also plays some or the other sort of role in coronavirus, especially before as well. Just now, before a person is infected, a person feels anxious of going outside, and a lot of people are now suffering from obsessive compulsive disorders as to wiping every single surface they can find so as to remain virus free. And among those who are going through COVID-19 infection, among them also there are several mental illness issues that they have to go through because of the trauma and of the infection, the stigma associated with it, all of it compiled. And after you recover as well, these researchers have shown that mental illness does stay with even the survivors for some time. So according to this particular research, they say that one of the reasons why mental illness subsides in the COVID-19 survivors is because of the immune response to the virus itself. The body's immune response to the virus does create some sort of a burden on the mental ability. And then there are the socio-economic factors which also go with it, like stigma associated with COVID-19 and several other factors. So first and foremost, why are we talking about mental illness and coronavirus? Mental illness is still a very taboo topic in the normal discussion sphere as well. So during the pandemic, it is even more necessary to talk about mental illness because we do not know how exactly this pandemic is shaping our mental illness, how is it shaping us psychologically. So to speak on the same, we also have with us Dr. Srihari, a psychiatrist. So Dr. Srihari, first and foremost, we would like to speak to you regarding why it is important to diagnose mental illness among COVID-19 patients who have survived and who have recovered from this virus.
Yeah. Generally, when people come to us, they do have anxiety or depression. There is a stigma attached to the coronavirus, and many of them do not want to say that they had undergone the infection and they have recovered. So, of course, since the government has made it mandatory that it has to be reported. So once they go through the infection and they are quarantined or treated in the hospital, they do undergo sort of self-isolation when they start brooding over the illness and they start worrying about it. Because as for the knowledge that they gain, that some of them may not recover, that fear continues. And once they recover, some of the people who are already having a previous history of psychiatric symptoms earlier, they are the people who are more prone to have the relapse of symptoms. Since they were already suffering earlier, so these people are more prone compared to the general population.
Okay. How can these people seek help at this point of time, and how do they first of all recognize the symptoms of mental distress?
Yeah, when the first and foremost thing is, see, in anxiety, what happens, they become very restless, they would have a body pain, they may not get sleep, and they are not able to concentrate, and they may have palpitation, they may have tremors. So these are the symptoms which which they have to recognize and seek help. In case of depression, people may not have enthusiasm or energy to work. They may not able to do the routine activities. They may feel they may not socialize as usual. So when they do have these sort of things, they may have to come to the psychiatrist and seek help, because if these things are not recognized, they may not be in a position to work the way they were working earlier. So the productivity comes down.
Okay. And also, Dr. Srihari, do tell us why it is important not to ignore these distress signals.
As I told, now the depression has become in another 1 or 2 years is likely to become the second most prevalent illness all over the world. Depression is becoming quite high. So when these sort of severe stress strikes, like a pandemic, the fear and the severe stress, they are likely to induce sort of depression or anxiety in the people, or post-traumatic disorder. So it's better they recognize and see what is the best way to deal with these things. I think it's not that all the people who come to a psychiatrist need medication. Even without medication, if they have mild symptoms, they can overcome it with counseling and some remedies which psychiatrists will be able to advise.
Okay. And can they also seek the help of family in this case?
Yeah. Family support is very important. I think sometimes the family counseling also has to go through. So they don't have to panic about these symptoms. When they have difficulty to sleep or not able to concentrate, naturally the other medical problems may increase, like diabetes, hypertension, and heart disease. So it's better that anxiety and depression should be taken care, and they must be treated by the mental health professionals.
Okay. All right. Thank you so much, Dr. Srihari, for joining us on this FB Live and speaking to us about mental illness and coronavirus. So it is quite important to recognize the distress signals and also seek help on time, because we may never know what will happen later on at an extended stage. So there is a link between mental illness and coronavirus, not just with this particular small study done by Italian researchers, but also the study also mentions that their findings corroborates with previous studies associated with the SARS coronavirus 1 outbreak. So any sort of a severe disease which strikes a person does leave some sort of a mental distress residue behind, and those distress signals are important to be recognized and sought help earlier on, so that going by there are no more complications. Thank you for joining us on this Facebook Live. Do leave your comments in the comment section down below. Thank you.